Welcome back to my channel, and today we are going to discuss whether or not you, my friend, should be wearing nails while pregnant. Now, this is a big topic. This question has been going around for years, and I am here just to give you some information on my thoughts on this and also thoughts from other people. Now, I'm going to jump into the video. I'm not going to take long at all because I know you are anticipating what I have to say. So let's get into it. The Business of Nails by Jewels Nails, Bad Girl Jewels Nails, all that. Welcome back. Now let's get into this video. Things to consider if you decide to wear nails during pregnancy. So these are things that you need to consider if you are wearing nails during pregnancy. It could be so much that goes on during pregnancy, but we're going to take it step by step, and I'm going to tell you some things that you should consider while pregnant, and in the end, if this is what you decide to do. All right, there's no wrong or right way, but once you get the information, you can make this out for yourself. All right, so things to consider if you decide to wear nails during pregnancy. So let's look at nail changes. During pregnancy, you may experience nail changes. Your nails may grow faster and stronger. It's also possible that your nails may be weaker and break more easily than usual. So I know once you're pregnant, if you've had a kid before, then you should know most times doctors will recommend folic acid and so for a lot of more nutrients and minerals, because sometimes the baby takes so much from you and it depletes the nutrients in your body. So that's why you have to get it by artificial means if you're not getting this from food. So because of this, sometimes your nails can get like real soft and brittle. So these are changes that your body will go through. Nail beds sometimes will get like real just feeble, weak. All right. So acrylic nails could damage your nails further. So this is saying to get acrylic nails to stick to the surface of your nails, it must be filed down. It's like you have to rub down the nail bed. And once you rub the nail bed down, you have to dehydrate and then prime, right? So of course, that could cause more trauma on a nail bed that's already weakened, right? So what they're saying here is, so if your nails are already weaker than usual because of pregnancy, acrylic nails could damage them further, right? So acrylic nails could damage your nails further. So that's another thing to consider. Nails can also get infected. So it's saying it's also best to stay away from gel nail polish since the chemicals in them haven't been well studied. So gel nails has just came out a few years now. They haven't been out that long, and the chemicals in them have not been studied as well as other chemicals. So they're saying to be on the safe side, just try to stay away from getting gel while pregnant until more research is conducted, right? One risk when anyone gets acrylic nails is that your nails may get infected. So your nails can get infected. This is something that can happen. You can get a fungus. Sometimes your nails do lift and you don't go in time to get a fill. So this can definitely happen, right? So they're saying this can happen if the artificial nails are too long or rigid. Now, too long or rigid, I'm not sure about that part, but what I could tell you is I know that if it's not properly sealed by the cuticle, yes, water can go up under your nails. Sometimes it doesn't have anything to do with sanitation, but it has to do with everybody's body chemistry is different. Sometimes my nails may stay on for 2-3 weeks and other people 1 week. Depends on how you cure your nails. You might have a newborn baby. You have to wash your hands. Situation is always different. You're not doing the same thing every week. Something is always different, right? So depends on what you do can determine how long you keep your nails on. So right here it's saying that your nails can get infected. These are some of the causes, but not all of the causes, right? So to reduce the risk of infection, you should take these precautions when choosing a salon. So these are 3 precautions you should take. Number 1 precaution is to make sure the salon and each nail technician have posted a license of certification. If they have a license, they went to school and they should know about good sanitation. So that's one of the reasons why it's preferred to you to go to somebody who is licensed, right? But sometimes, their license doesn't mean that they know what they're doing, right? But it would give you a better chance and make you feel more comfortable if that should happen, if they should post their certification, right? Also, number two, the technician should wear new gloves. A lot of time at certain salons, they'll have gloves on, but that gloves is protecting them. It's not really protecting you, because some salons can have the same glove for every, which is not sanitary. So you have to keep an eye out for that. If the nail technician is using a glove on several people, you should say something if it's your turn. All right, say, hey, you know what, can you change those gloves? They shouldn't have a problem. If they do, that's not where you need to go for a service. Okay, number three, to protect your cuticles, your nail bed, and your nail bed from bacterial fungus. Okay, I don't know what happened right there. Now, number four says clippers and other tools should be properly sterilized in a autoclave sterilizer, right? Which uses heat to kill the bacteria. So an autoclave sterilizer is something that uses heat to kill bacteria from like the nail instruments and so forth after you sanitize and you place them in there. And also it says here, non-metal files, buffers, and sticks should not be reused. So non-metal files, so basically regular nail files that you use to file the nails down, they should be disposed of. Sometimes as nail techs, we tend to want to use our file maybe once, twice, or maybe even 3 times, but it's not sanitary at all. So if you want to reuse your file, which you should not, I suggest you figure out a way to sanitize that, right? And it says you can also bring your nail tools if you prefer. So if you're to the salon and you're kind of cautious, you can bring your tools with you. Go ahead and bring your tools, right? Now, this right here is talking about brief exposure to salon chemicals. So it's saying nail salons use some chemicals like toluene, formaldehyde, and dibutylate. Dibutylate. And acetone. Some of these chemicals are cancer-causing agents, right? So you want to be very, very mindful and cautious with these things. So let's get into it. So toluene is a chemical also found in gasoline and may cause anything from reproductive issues to dizziness, all right? So we would try to stay away from toluene. Now, toluene could be in some type of maybe nail polish, gel polish. I'm not sure what chemical this is in, but I know it's a chemical that's in the salon, right? In one of the products we use. Formaldehyde, that's another chemical that's used in some of the products that we use. It's a cancer-causing agent that's also used to preserve dead things. You should avoid inhalation and skin contact, okay? So with formaldehyde, you don't want to breathe this thing in, and you do not want this to get on your skin, all right? It will irritate you, and whatever goes through your skin might go in your bloodstream, might go to the baby, all right? And this last one, I cannot even pronounce. This one here is called dibutylate. It's classified as a higher danger level because it can cause reproductive issues and may also cause organ issues that disrupt the hormone system. So when you're pregnant, you're already going through all kind of hormone situations. You do not want this to disrupt your hormone system, right? But these chemicals I just discussed, these chemicals are stuff that, you know, you have to technically be around constantly. And, you know, you can avoid these by having proper ventilation in the salon, right? So that's one thing to consider also. So wherever you're going to get your nails, if it's not properly ventilated, then you might have issues, right? But there's no concrete evidence that a brief exposure involved in a manicure is harmful to your baby. So they're saying right here that a exposure to a manicure is no evidence that that's harmful to your baby. So that's one thing you can consider, just getting a regular manicure, right? Something where there's no nail polish, just something nice and simple and clean. So now I'm going to tell you about the exposure. So small levels of exposure. Very little of each chemical enters through your lungs or is absorbed through your nails and skin. These small levels of exposures are not expected to cause problems for your pregnancy or baby. So they're saying basically that small levels of exposure is not going to cause problems to you or your baby. But how do we measure exposure? How do we know how much exposure is actually going into our body? If they're saying small levels, it's not going to cause a problem. How many times are you getting your nails done per week? How many times are you getting your nails done per month? How many times are you getting your nails done within that 9 months while you are pregnant, right? So who determines what small exposure is? skin irritation while pregnant. Your skin tends to be more easily irritated during pregnancy. So some products may cause redness or tenderness. This is not likely to be a risk to your baby, but you may want to avoid irritating products or switch to something milder for your comfort. So if you're having products and you're not, stuff is not agreeing to your skin, this could cause a problem for you. So you want to switch to something milder like soap or something else, or just stop getting your nails done and using those strong primers and dehydrators and so forth. Just try to go for something more natural. So as far as ventilated areas, if you use nail products occasionally in a well-ventilated area, there's no known increase or risk, whether you use them at home or go to a salon to have them put on. You're probably not getting enough exposure to cause a concern. So they're saying that you're probably not getting enough exposure as a concern if you're in a well-ventilated area. But like, as I said before, who determines what excessive amount of exposure is? So if you're also a nail tech who is working in a salon and being pregnant, it's advised that there's no definite evidence that being around the chemicals used in nail products can cause problems to your developing baby. Well, like I said, it all goes back to exposure. Who determines what enough exposure is? If you're pregnant and you're working in a salon, you're being very, very, very exposed. But because experts aren't sure how much exposure could potentially lead to adverse effects, therefore, they're not sure how much exposure could potentially lead to side effects, right? So you have to reach out to your doctor and see what they say if they are concerned about your health while working, doing nails, and also being pregnant. Also, the Center for Disease Control and Prevention, they recommend that you try to reduce exposure when you can. Like I said, who determines what exposure is, right? Before the Center of Disease Control and Prevention recommends that you try to reduce exposure when you can. So what is that saying to you? I know what it's saying to me. If you don't need to get those nails done because you are pregnant, then don't get them done. But if you feel like you need to get them done, get them done. But just be cautious. Use the preventative methods mentioned earlier. Some precautions you can take include: number 1, wearing personal protective equipment, including masks and gloves. Now, we wear masks every day now, but the gloves, we don't wear them so much. So you could wear mask and glove as a protective measure, but having on gloves and getting a manicure or your nails done is definitely not going to work. Number 2, you could regularly wash up to get chemicals off your skin. So if you've been to the salon and you feel like you've been overexposed and you smell like acrylic, when you get home, take a shower. All right. And if you work in a salon, you're going to work in a well-ventilated environment. So if the salon you work in does not have enough ventilation going on, try to sit by a window or try to do less clients per day. If you're a nail technician, talk to your healthcare provider to talk about safe work practices. So my conclusion to this is, while being exposed to some of these chemicals, the mother should ultimately decide if you want to wear nails during pregnancy. So with all the information I just gave you, you decide. Now, if you've been wearing nails and this has been a concern for you, this might be your first pregnancy or second pregnancy, and you are just way, way, way more cautious, then leave in the comment below and let me know what your thoughts is on this. All right. Thank you for watching Jewels Nails, the business of nails. Bad Girl Jewels Nails. Subscribe below and all these other things.